歡迎大家出席今日嘅記者會。
Welcome to today's press conference. With us today are Dr. Edwin Cui, Controller CHP, Dr. Chung Suk Kwan, Head of Communicable Disease Branch CHP, and Dr. Sarah Ho, Chief Manager HA. Dr. Cui, please. Friends of the media, as of today, we have 140 Omicron cases recorded. We start with two sources now in the community. Omicron is spreading, and one of the cases is 12754. This has generated 13 cases. As of now, there are at least three second and third generation chains of transmission. One of the chain of transmission, we believe that within a matter of 10 days, it started off from an imported case. It was spread to her mother and her mother's friend, her mother's friend's husband, and also the colleagues. There has been four generations, not 6 to 8. One Omicron case, unless we control this properly, can be spread to 6 to 8 people. Now, with 4 generations of transmission, we're talking about multiple cases of transmission. So we cannot rule out in the community out there. We do have some silent chains of transmission, and there are people who are asymptomatic. We have tightened the social distancing measures. We hope that we will get the cooperation of the members of the public. And within a short space of time, we will be able to stamp out the long chains of transmission. We understand that this is stressful for the members of the public, but if we do not do anything to control the transmission, the consequences can be really ghastly. The WHO has announced today that unless we take control measures, given the spread, the rate of spread of Omicron in other countries, the spread is like a tsunami kind of spread. We urge the members of the public to observe social distancing measures and stop unnecessary mixing, and in particular cross-family mixing. We would never know any of our friends or relatives are carriers of the virus. We also urge the members of the public to minimize any presence at crowded places. Since a fortnight or so ago, we have issued a lot of CTS or CTN, and I hope that you would let your family members know if you've been to any of the high-risk places, please go get tested. Now, at the beginning, we will conduct intensive testing. For the first testing, if it is negative, please do not overlook your situation. It might take 1 or 2 tests for the virus to be picked up. So if the test comes through negative, please do not underestimate that, and still do not go mixing with other people and go to crowded places. Please observe all the health protocol, like you have to wear your mask properly, health, hygiene, personal hygiene. We find that in a lot of high-risk activities, these are mask-off activities. So please refrain from attending any activities that you have to take off your mask. In restaurants, inevitably, you have to take off your masks. So in the course of a meal, please do not engage in any conversation, because this is likely to spread the virus. And please put on the mask again after a meal. For those who are unvaccinated, now is the time to get the jab. If you still have doubts or any misgivings about the vaccination, I'd like to explain to the members of the public that at this critical juncture, the vaccination would minimize the chances of getting infected. Second, it would minimize the situation of serious illnesses as a result of the infection, in particular for those vulnerable and the senior citizens. Third, with vaccination, even if you get infected with COVID, the viral load would be low, and the likelihood of you transmitting this to your family members would be minimized. So getting the jab would be protecting yourself, your family members, and also our society. Like 2 years ago, our infection control team has been trying very hard to track and trace the cases and the close contacts and try to isolate these cases. And hospital authority is making every effort to treat the patients. We urge the members of the public to be cooperative. We hope that we can bring this episode to a close as soon as possible so that we can be back to normal as soon as possible. I hand you over to Dr. Chong for the cases today. We have 33 positive cases, 12837 to 12870, and there were N501Y and T478K mutations. Some of the cases are being looked at. There are about 30 preliminary positive cases. Now, of the 33, 26 are imported cases, one from Germany, and upon arrival in Hong Kong, he tested positive, and there are 5 coming from the US, CXA45 and CX1922, January 4th, C416906, and 6. One is PR300 on the 30th of January. December. QR418, one on QR418 from Finland and the UK, QR418 of January the 5th, and there are 5 coming from Germany, LH796 arriving on January the 6th. There are some preliminary positive cases that have become positive, and they picked up from Penny's Bay. There are 7 of them. Now for these 7, they are imported related cases. 12838 on January 5th. The person has been sent to the quarantine center, a female 37 years of age. She's living at Serene Court in Tin Hau Temple Road. She's asymptomatic. She's been sent to the quarantine center, and the results came back on the 5th of January as positive.
She had received 2 shots of the vaccine, and she actually worked at the Wing Yun Tea House in Bailey Street. We believe that she is infected by her mother. During the high-risk period on the 3rd of January, she had gone to a Spanish restaurant in Wan Chai attending a birthday party. The name of the party, I don't know how to pronounce that name. It's called Reserva Iberica Tapas Bar and Restaurant, which is located in the in Wan Chai. I think from 9:30 to 10:15, she was there during that time period. We understand that the activity or the function which was held at that restaurant started from 6-something p.m. to midnight, and about 170 people actually arrived at the venue after 9:30. They were still there after 9:30, and those people would need to be quarantined. We've just received of another positive case, and the case was present there earlier than 9:30, so the number of people quarantined will go up. The second confirmed case is 12839, and she actually went had a meal at the East Garden Lafayette restaurant. She is actually a 63-year-old male living in the Pickon House in Yingon Court on the 30th of December. At the Windsor House 15th floor, she was at the East Ocean Lafayette restaurant and had a meal there. At the same time, 12524 was also having a meal there. This patient started to develop symptoms on the 3rd of January. She attended a private doctor on the 4th of January, and the sample taken from him was proved positive. She had earlier been vaccinated. We understand that there have been 2 tables at that restaurant where confirmed cases were identified. So we immediately went to the premises together with EMSD and the EMSD colleagues. We went to inspect the premises, and we've taken some smoke tests there. The 2 tables were involved were rather close to each other. One was close to the window, the other one was behind the window. And the smoke test in the smoke test, we found out that the ventilation in that restaurant was such that the table, to the near side would be blowing towards the window. And 12754 was sitting at a table, a little bit behind. 12839 was sitting near the window. So it's because of that the person was infected. So during the same time period, there could have been other patrons of the restaurant who could have been affected. We understand that 130 restaurants were eating at the restaurant from 8:10 to 9:10 hours. So we are now conducting contact tracing. We are tracing the octopus card and credit cards to locate the customers who were there at the premises at the time. Now, if you were at the premises or having a meal there during that time period, please contact us as soon as possible. We understand that some people, we may not be able to, trace some of the customers because they pay by cash. So we hope that they will contact us as soon as possible. At the restaurant, we also obtained 69 samples, all of which have been tested negative. Another case involved 12840, and we were still conducting contact tracing and identified the transmission chain. She is a 67-year-old female living in Fung Fai Terrace in Happy Valley, a housewife, and together with 12806 at a restaurant, at the Fu Hin restaurant, which is located on the 6th floor of Windsor House in let me check. I think it was the 1st of January. She was having a meal at the Fu Hin restaurant there. They were sitting at 2 tables, but they were next to each other. For the customers sitting at those 2 tables are close contacts. We will continue to, contact them, and we hope the restaurant will also undergo thorough cleansing. The 4th case is 12841. The husband of this case was confirmed positive more or less at the same time. So she is the husband of 12825, and she is also the close contact of 12754. And she had actually been dancing at the Causeway Bay Community Center and also at breakfast at the 6th Garden restaurant. On the 5th, she was sent to the quarantine center and proved positive on the 6th. She had not been vaccinated. 12854 is the second domestic helper living in Hui Chik Street in Tai Po, and the building was subject to compulsory testing yesterday. Together with case 12805, she actually attended a fellowship, service in North Point. She actually was there on the 31st of December, and the other Indonesian domestic helpers there will also be sent to the quarantine center. 12860, she was already at the quarantine center on the 1st of January. She lived in the City Garden on the 30th of December, together 12754. She was dancing at the Causeway Bay Community Center, and she is therefore identified as a close contact and sent to the quarantine center and confirmed positive subsequently. She had been vaccinated. Another case confirmed positive at Penny Bay last night is actually a person living is the owner of who live in Kam Fong Court of the Kam Fong House in Ma On Shan. We have one case, 12654, who was at the Moon Palace having a meal there on the 27th. On the 29th, well, the person is a scaffolding worker. She was, erecting a scaffolding and actually gone into the premises to perform some works, and the female patient at that time was at the scene. On the 1st of January, we already sent her to the quarantine center, and the results, she's now proven to be positive on the 6th of January. So these are the confirmed cases. We have 30-odd cases, positive cases, which I would like to talk about. And we have children, 126767, namely the confirmed case living in Trading Garden in Tuen Mun is the son, is the child who actually attend schools in the Tuen Mun Shun Tak Fraternity Association Learnly Women Kindergarten, attending class K2. Last day attending school was the 4th of January. Last day of attending school was the 4th of January. For that kindergarten, when we learned that the father was preliminary tested positive, we we have now learned that the students in the same class, because for the kindergarten they have 9 classes in the morning and 9 classes in the PM, and so the child would only be attending school with the same pupils in the same class. There are 45 people in the same class and a few teachers, and they're all close contacts would need to be quarantined. For the students and the teachers, about 600 odd in total will all have to be tested. Another preliminarily positive case lives in Tai Koo Shing in the Yin Kung Court, a 74-year-old male. She works at the CITIC Securities Company at the at the Crown at the in North Point, together with 12825, who had breakfast at the Six Garden restaurant. She is a family member of a close contact, namely her husband. She works there. And this newly confirmed, preliminary confirmed case is her colleague, and her colleague has been sent to the quarantine center. Other than her colleague, on the 1st of January, she attended a alumni a gathering of the Fukien Secondary School, after which they went to a restaurant where they have meal together with 60 to 70 people. For all these people, they are considered to be close contacts.
Now she's symptomatic, and she's gone to Rajiji Hospital and was tested positive. There is another 32-year-old female, and she's a close contact of 12838. She's a 32-year-old female. She is working at the Wire Lit Association. Last day at work was on January 5th. She's living in Chai Wan Estate, Wan Pun Court. She has been vaccinated. On the 2nd of January, she went to the entrance of the product BPE. Brand and Product Expo with 12838, and they chatted for a little bit, and she took off her mask for some water, and it is likely that she was infected there. And for other high-risk places she's been to, after getting in touch with the positive patient, she was likely to infect other people, and for the places that she's been to, we will send the close contacts to the quarantine center, and CTN would be issued. She's been to Hong Hum Station McDonald's on January 3rd. On January 4th, she's been to Goku Ko Stone Grill Steak for dinner. And 12838 also appeared at that time, albeit briefly, and she just appeared to say hi. So it is unlikely for her to be infected on that occasion, less likely than it would be at the BPE, Brand and Product Expo, and she went to get tested thereafter. The other one is the third Indonesian helper. She's living in Yok Seng Street in Happy Valley. Again, on January the 2nd, she's been to the fellowship, and on the 1st and 2nd of January, she's been to the fellowship, and she met 12805, and it's likely that she was infected there. There is another one. That on the 3rd of January, she's been to a birthday party in Wan Chai, and she's a female, 53 years of age. She's a media worker. She's living in Yan Lai Fa Yuen in Ho Man Tin, Block C, on the 3rd of January at about 6-ish to about 8-ish. She attended the party, she was eating and she was drinking, and she took off, she kept the mask on and off, and before she left, she greeted some of the attendees, and she's a confirmed patient now, and the whole time she attended the gathering. And we would classify the attendees as close contacts and have to be sent to the quarantine center. There is another one case which we cannot quite get a source of infection. She's a 58-year-old female. She's living at Leighton Building in Lockhart Road. Mainly, she would go to various supermarkets, Manning's, Park and Shop, U Select, Welcome, and so on, to handle the goods. And she's been to a lot of these venues or these outlets. You select Welcome, Park and Shop, Manning's. Has been to all these places, different places in Hong Kong for work. During the incubation period, we haven't quite found any high-risk places or any places that have been visited by the confirmed patients. So we will follow up on this so far untraceable case. Other than having been to these places for work on January 4th, she's been to the Wan Chai market. On January 3rd, she's been to a private kitchen, Yu Yi Bing Shan. And on January 3rd, she also has been to the BPE at 12:45 for about 40 minutes. And on January 1st, she's been to a restaurant for a meal. On the 27th of December, she went to a place called Seong Lok, and she also has been to Wan Chai market. So we would follow up on any further details to identify any high-risk places where we can identify the source of infection. And also one more, on my way here, there is a preliminary positive case, also an Indonesian domestic helper, 44-year-old, living in Tseung Kwan O, Onling Garden. She developed illness at the quarantine center, and this is a preliminary positive case. Dr. Ho, as of 9 a.m. this morning, over the past 24 hours, the hospital authority has submitted 48 cases. As within the 24 hours, we have not had any discharge of patients discharged. There were 12,230 patients who have recovered and been discharged. There were 348 patients who are tested positive that are scattered in the North Lantau Infection Control Center, the Hospital Authority Infection Control Center, and AWE facilities. One is in serious condition, 347 in stable condition. In terms of hospital beds, 1,081 utilization rate is 54%. Negative pressure ward 603, utilization rate is 64%. Also, Dr. Chuang mentioned a 4-year-old child. I'd like to supplement further information. Now, for this child, and this is a pediatric patient infected with COVID, and at Pennis Bay, he developed runny nose, and on January the 5th, the child was sent to the Tuen Mun Hospital A&E for checking, and the child was sent to a pediatric ward for treatment in isolation. Now, the girl was put in a bed with guards, and there is a call bell given to her, and we ask her to press the bell if there is such a need for help. Now, that girl, at about 8 p.m., walked out of the cubicle, and she was standing at the corridor. At that time, she was unmasked, and the nurse on duty spotted her, and she was arranged to go back to her cubicle. And that nurse and also a patient assistant immediately donned the protective gear at the PPE and settled the girl back into the cubicle. When the girl was wandering into the corridor, the nurse and the attendant had N95 and surgical mask on, and they didn't have the face shield. We consulted the CHP, and these two colleagues would be classified as a close contacts, and they have to be quarantined for 21 days. And the Tuen Mun Hospital has arranged for that particular place to be completely disinfected. And this girl tested positive this morning, and she has been transferred to Princess Margaret Hospital for isolation treatment. She's in stable condition. Also, I'd like to take this opportunity to let you know that as the situation is taking a turn for the worse, and we have to adopt adequate measures, and we like to make every effort to cut off the chain of transmission. Going forward, we will be distributing the testing kits to our colleagues, and every single morning before they turn up for work, they have to undergo self-test. And this is the arrangement in public hospital, and this is a critical juncture. This is the exceptional arrangement for this critical juncture. I would like to achieve early identification, early isolation, in order to protect our colleagues and the patients against any asymptomatic patients. We also remind the frontline colleagues to stay vigilant, and patients should tell us all the necessary information, like whether they have any travel record, their work background, whether they have been exposed to any confirmed patients, or whether they are undergoing any compulsory isolation. And this is important for us to implement all the relevant measures and infection control measures, and also for our staff to don all the necessary PPE and equipment.
It's now question time. Please put up your hand, and we'll give you a microphone before you ask a question. Also, please tell us the organization you represent. Second last line, the person in green. I'm from cable TV. Now, why is it that for the people who attended the birthday party, all of them have to be segregated? Is it because in that party certain high-risk activities took place, like people singing without, wearing a mask, or, eating a buffet there, thus increasing the risk of, infection? Would that result in an outbreak? And also for the family members of the officials who attended that party, would they also need to be quarantined? Also, while they were not wearing masks when they were eating or singing, will these people be prosecuted? Did all these people, scan the Leave Home Safe app, like Mr. Au Kawang? For the 53-year-old woman who was preliminarily confirmed positive, you said she was a media worker at that birthday party. Did she had any exchange with 12838? And if not, can you trace the origin of her infection? Perhaps I can defer to Dr. Cheung to explain further about that particular case. Our approach, in investigating into the confirmed cases are the same. First of all, we will, trace the contact history of the case concerned. For each case, we will look at, we will particularly focus on the incubation period. For example, the few days before incubation or the onset of disease, and also the time after they have been, tested positive. We would like to find out, whether the person was engaged in high-risk activities during such period, other than activities in which, the masks were not donned, and also especially in crowded places, because Omicron is a very infectious, virus. So when people are not wearing masks and you have, exchanges among many people, the risks of, infection will be higher. Dr. Cheung could perhaps elaborate on the particular case in question. According to our understanding, the new preliminary confirmed positive case, I think the case from 9:30 to 10:15, she was in the hall or lobby. This preliminary confirmed case was there before 6 p.m. and she stayed there until 8 p.m. and then she left the premises and came back to the premises at 9-something to say hi to the other people at the party, and she left at around 9:30 p.m. She was actually, had some brief conversation with people at the entrance to the restaurant, or saying hi or saying goodbye. So at that time, 12838 arrived at that time. The two of them did not know each other, so we don't know whether or not there have been any exchanges between the two, or were they in the same space. So it's likely that the new preliminary confirmed case, her source of infection could be elsewhere. Of course, we cannot rule out the possibility that she was infected elsewhere or, was infected at this party. And she was at the, before she was confirmed positive, she'd also been to a restaurant and where people could eat or have drinks. And when they did that, they have to remove the mask. And they were not, staying in a fixed place. So it's very difficult to say which location they were in. They were the close contacts of any other patient. So all the people who are present at the party would need to be, quarantined. Normally, family contacts and close contacts will need to be, quarantined for a brief period of time. I think that's all. Sorry, the speaker is not speaking in the microphone. I think as far as the investigation is concerned, regarding the details, we have the Leave Home Safe app and the procedures to be followed at specific premises. We will ask the FEHD to follow up. So what is the view of the Bureau regarding those suggestions? Now, regarding the social distancing measures for different bureaus and government departments, and also the CE at the press conference have already touched on that. I think the measures that we've implemented, I think we are already, launching very, draconian measures already. So 7 days from now, we will recap on how effective these measures have been during the 14 days, and then we will next decide whether we should stiffen the measures further or could we be able to relax the measures a bit. So this is something that we will review in due course. As for the question regarding the internal operation of the government, the CE at the press conference already have touched on that already, so I will have nothing further to elaborate. We have a large number of people to be quarantined this time. The relevant departments and bureaus, if they should have colleagues who cannot discharge their duties because of that, I'm sure they have ways to cope with that situation. Dr. Chung, for the school, sir, we only have, a 4-year-old child who is now a confirmed case. I'm sure the government will monitor the situation, and if necessary, new social distancing measures will be launched. The last row, lady in white, TVB. Now, with so many close contacts and confirmed cases will need to be quarantined. Do we have enough quarantine facilities? What is the situation like at Penny Bay? And secondly, the Director of Immigration, Mr. Ao Kah Wan, is it confirmed that he is already admitted to the quarantine center? Regarding our quarantine facilities, at Penny Bay, we have about 3,400 units. But other than Penny Bay, we also have other quarantine facilities standing by, including the Lei Yuen Mun Resort, the Sai Kung Recreation Center, the Pak Hang, JCP, center, and so on. We also have certain hotels which we can turn into a quarantine facility. Altogether, we have about 4,600 units, which could be, made available for quarantine. We've used about 1,500 so far. We will closely monitor the situation. We'll have to look at the number of cases and the close contacts. So we need to monitor the number on a daily basis. As for the whereabouts of individual persons, I'm not able to answer that question. But for some of the outbreak and for persons who need to be quarantined, we are steadily implementing the quarantine. And some have been sent to the quarantine center. Some are about to be sent to the quarantine facility. The lady in green, the last row. I'm from Ming Pao Daily. First of all, regarding birthday party in Wan Chai, the Department of Health, according to the estimate, how many close contacts have there been? How many second-tier close contacts are there? Some guests said that they've left before 9:30 and they've been tested preliminarily positive. You say these two persons did not know each other. Do you know whether the two of them now have been in contact with each other? And how many transmission chains have there been at that party? Have you collected environmental samples at that restaurant and tested the ventilation system there? And secondly, for a preliminary confirmed case, the untraceable cause, the 58-year-old woman at Lok Hak Road, how many close contacts have there been? How many supermarkets did she go to? Did she go to the Tin Hau area where there have been outbreak recently? So also the Indonesian helper at Ngorning Garden, what activities was she involved in recently, and what have been her contacts? And also regarding other, premises where there have been an outbreak, the Phu Hin restaurant and the East Ocean Lafayette restaurant and the Fellowship, had there been any new cases? Have you collected samples and carry out ventilation tests at those premises?
I defer to Dr. Chuang at the moment about the details. In connection with the birthday party cluster, we are investigating on two fronts. We noticed one case. The period of stay was after 9:30. We look at the nature of the event. Some were still there after 9:30. They are classified as some close contacts. So we are still getting on with the quarantine work. Dr. Chuang reported a preliminary positive case. Now that case stayed between 6 and 8 p.m. And at 9-ish, the case came back to meet the attendees. So these are the different investigations. Now, after 9:30, of those who were still there, they were close contacts. But with the appearance of this case, between 6 and 9 of those who were in contact with this case, they also are close contacts. So our view is that basically those attending the event are close contacts. So we are looking at the attendees at the event. Dr. Chuang, if I may supplement a little bit, and I talked about the preliminary positive case that arrived before 9:30. The CT value is pretty high, 35 or 36, and we'll have to await the lab results before we take any further action. If there is anything new, we would bring you up to date immediately. As to the Tseung Kwan O case, that's 12805, the close contact of 12805. They belong to the Fellowship. This is a close contact. We do have a list of the people there. Now, we would collect environmental sample in some cases. That's because we do not figure that transmission would take place. Like there are two tables, and these people are not acquainted with one another, and we like to have some environmental sample to ascertain the route of transmission, whether there is an airflow implication or any environmental issue, that we would conduct on-site investigation and took some samples. In other cases, you would expect that transmission would take place, like Worthy Garden. There are two tables, and they belong to the same group of people, and they do have a lot of contacts, and also the fellowship. We understand that they would have meals together, they would engage in dancing and various other activities. We would expect that transmission would take place. So when we take environmental samples, we would go to places where we can't quite figure out why transmission is taking place. Speaker not coming through. After 9:30, those who were there were close contacts. We had about 60, 70 people, and those living with them would have to be sent to quarantine. There were 160, 170 people at the party. We will ascertain whether there are any positive cases. The CT value is pretty high, and there may be some other situations. So we'll have to await the lab results before we take any further action. An English question, the lady in white, please.
A few questions from SCMP. With hundreds of people to track down, have health authorities reached its manpower limits in terms of contact tracing work? And what sectors were involved in the party cluster, and is there a high risk of outbreak among the party goers? And will authorities investigate violation of social distancing rules? And also, which restaurant did the second prelim case from RTHK went before she was infected? Thank you.
Okay, so I think later I would like Dr. Zhang to explain to you the current investigations of the party clusters. So for the investigations and also the enforcement matters, so I will let our other departments to follow up here, because we'll pass some information for them, including the conditions of the restaurants serving the guests at that time. So for the government officials or other any persons who involved in these clusters, and maybe they have to be quarantined in quarantine facilities, I think the relevant bureaus and departments will handle the manpower issues.
You asked for what activities the newly preliminary positive case. We have looked through all the activities and have not found any, I mean, of course she visited some places for meal and also for drink and etc. But we have not found any confirmed case or preliminary positive case who had visited these places. So she has no other epidemiological link to any known or preliminary positive cases, except for this occasion. We have asked, I mean, we have a contact tracing office, and we have a surge capacity plan, so we have asked other departments to redeploy some more officers to help us.
下一位。
Next, if there are no further questions, that's the end of our press briefing. Okay, the last row over there. I'm from Economic Times. During the birthday party, the 170 odd people, how many of them have now been sent to the quarantine center? How many of them are waiting to be sent to the quarantine center? For the two preliminary confirmed cases at the party, according to the Leave Home Safe app, what was the time of the attendance? Had there been any overlap? If there is no overlap, would there be any causal link as far as the infection is concerned? And for the media worker, is she now suspected to have been infected by the Omicron virus. And for the East Ocean Lafayette restaurant, what was the distance between the two customers who were, eating there? Is it that all the 100-odd customers there had to be quarantined? There was also an outbreak at the Fellowship. How many foreign domestic helpers have been sent to the quarantine facility? And also for the family members of the close contacts, do they also need to be quarantined for 21 days like the others? Also, the Hong Kong University, health, clinic. I think I'll ask Dr. Cheung to, elaborate on the few premises that we need to monitor. There are several premises where there have been outbreaks, and the outbreaks involve people who are not acquainted with each other, and we are more worried about that. For people who are acquainted with each other, then they would be infected in the same place. For the Six Garden and the East Ocean Lafayette restaurant, we are particularly focusing our attention on these two premises. For the East Ocean Lafayette restaurant, we look at the seating arrangement and the airflow in the restaurant. We are worried that at that premises, as in the case of the Moon Palace restaurant, there could be an extensive transmission. So we have to be cautious. So for those people who have been present at the Six Garden and also the East Ocean Lafayette restaurant, they should contact us as soon as possible and take a test. As for the party cluster, there are two parts to that. First of all, we have some confirmed cases yesterday. We're talking about roughly 60-something persons who were there after 9:30 p.m. So we are steadily sending these people to the quarantine center. At the quarantine center, we now have more than 60 persons who've already arrived there, and the process is still ongoing. You asked about the CT value of the preliminarily confirmed positive case. It's about 35, 36. For the two tables of the East Ocean Lafayette restaurant, the two tables are next to each other, although they're not sure which table exactly. But I think they were actually, sitting at two tables very close to each other. So there have been transmission in this restaurant. But in the case of the Moon Palace restaurant, we've learned that the transmission could take place not between people sitting at two adjacent tables. So it's not just people sitting at the next table who would be close contacts, but I think it should involve the whole restaurant. There were 73 close contacts at the Fellowship. But we found out that the case was not on the list. So we need to talk to the Fellowship further. There could be, we need to ask them for another further, attendance list or name list. As for the Hong Kong U case, the person who went to the clinic at Hong Kong U is 12639. To supplement on Dr. Cheung's point, in the party cluster, there is another part that we are looking at, and that's another case that Dr. Cheung reported to you earlier. That is a preliminary confirmed positive case with a CT value. We're still looking at the CT value of the case. The CT case is relatively high, so we need to find out whether in the end it's a confirmed case, because we need to confirm that if the CT value is high. If this is a confirmed case, and based on the activities which took place at the time, the close contacts would be those who had been at the premises at the time. What is important now is to confirm what is the final verdict on the preliminary confirmed case. The first one, the CT value, I think we need to wait for the result from a private clinic before we know whether it involves, variant mutant. For the family contact of the close contacts, 7 days. Perhaps you can take one last question. 12754, the mother of the air stewardess. She had infected more people. Would you say she is a super spreader? Or is there any reason why she actually infected so many people? I'm sorry that we will only allow one more question. Will she be quarantined? Or are you waiting for her to be confirmed to be a positive case before she will be quarantined? Regarding 12574, she had so far infected 13 other persons. The main time of the transmission took place on the 30th and 31st of December. She had a relatively high viral load at the time, and she had actually was involved in some, activities with her friends, exercising together and so on. And also the person infected were sitting rather close to her in restaurants and so on. So it would appear that while she was having a very high viral load, she had a high, transmissibility when she was at a more relatively crowded place. And she was so she had a very high viral load at the time, and therefore we'd like to remind the public that if you're not vaccinated so far, you should do so as soon as possible. (24 to 26 roughly). Okay, perhaps one more question. Now TV. Regarding the Six Garden restaurant, have you checked on all the customers who were there? And also at the party, did the people there actually remove the mask when they sing? Now for the CHP, are you saying that Hong Kong is now already into the 5th wave of the epidemic? I think the situation now is very, serious. I think over the past 10 days or so, we've seen cases which already generated 4 generations of transmission within a short time. Of course, we need to look at the results of the investigation. Looking at the time of the gathering, there had already been several generations of transmission. So there therefore could be several rounds of transmission chains, and we may have people who are silent carriers of the virus. So this is the time when we need to take, urgent actions to control the spread of the virus. If we fail to do that, the number of infection cases will steadily go up, and that would result, as in the case of the 1st to 4th wave of the epidemic. So the speaker's not coming through. We haven't found that yet. So we are appealing to people who were at the Six Garden restaurant at the time on that day in question. They should contact us ASAP. We are appealing to them. We've also put up a notice at the door of that restaurant, so the people in the neighborhood should, if they read that, they would know.